So one of the most common things that patients are going to complain about as far as being tight is hip flexor tightness, probably secondary or maybe as much as hamstring tightness. And the one thing I want people to kind of rethink is, are these muscles really tight? Are they shortened? Do we need to keep stretching them? And I ask that question because you stretch them, you kind of feel better, and then 10, 15 minutes later, you feel like you got to stretch them again. So there's probably something else going on as far as your kinetic chain, your core stability, so on and so forth. One approach you can do is actually load your hip flexors. So let's maybe try to activate them or strengthen them. You'd be shocked at how much that tightness actually is relieved. Okay, so we're going to go over an exercise to target your big main hip flexor called your psoas major, the psoas. This guy it originates on your lumbar spine on all 5 vertebrae and kind of branches out into the front of the hip. So it's a very, very powerful hip flexor. It can also have impacts on the spine as well. So we're going to do what's called a psoas march. So all you need is a band loop of some sort. I'm using a Perform Better band here, one of the XL sizes. Anything should work. So what you're going to do is you'll lay on your back and you're going to put the band around the feet like this. So what I'm doing is I try to give myself a little bit of space between my feet by spreading apart a bit. That's going to kind of get my glutes going a little bit, but you don't want to push out too much. Now, the most important part of this exercise that most people neglect when they're doing any kind of core exercise is you have to keep neutral between ribs and pelvis. So one way to think of it is there's something underneath my lower back. I'm going to try to squash that. So I'm pushing my spine down. What that does is it tucks my pelvis under. At the same time, it pulls my ribs down. So I'm trying to get the pelvis and the rib cage parallel. So once I do that, I breathe in, get good pressure here. And then what I'm going to do is maybe I'll start with the left leg. So I'm going to straighten my left leg out. At the same time, I have to keep this knee in the same position. So I extend all the way out, slowly come back. So when you're pushing with the left leg, you're working on the right hip. And I come back, and then I'm going to slowly go the other direction and back. And you should feel that burn at the front of the hips here. If you start noticing that your lower back's getting tight, that's probably because you're hanging out an extension here. Revisit the first step we talked about. Other key aspects here is you don't want to let that knee track inwards like this. A lot of people, especially that have anteverted hips or they struggle to control like knee valgus or the knees going in. They're going to want to do that. So you want to almost envision like an arc motion. The knee, I'm going to kind of make sure I keep it out and back in. And that goes for the hip that's staying still too. So try to keep it out just a bit. Squash the bug, pull the ribs down. And so I want to go slow and controlled at first. So I'm just working on a little bit of endurance here. When you get better at it, we can go quick movements, but I'm not letting this band jerk me around. So if I push, my knees are falling, not what you want. So you want to be able to push and hold, push and hold. Another variation we can do is I can straighten the leg like this, and then I can slowly lower the whole complex together and then bring it back up. So it's just adding a little bit more of a dynamic load. At the same time, keep engaging your front core here, keep your back flat. So with psoas marches, again, just learning to fire your hip flexors with a good neutral pressurized core, meaning pelvis, rib cage, stacked. The number one thing I find that people struggle with, which ends up resulting in lower back pain and or hip impingement, things like that, is they don't know how to get out of this position. So every exercise you do should reinforce that. So good little burn on the front of the hips there. Go ahead and try this out. See how you feel after. If your hips feel tight, go load them. It's such a better strategy. I can't speak enough that we got to get people out of this constant, I need to stretch and mobilize. It's not what you think. Promise you that. Let me know what you think.